Are you over 40 and something just feels off? Maybe you're waking up at 3 a.m. drenched in sweat, or you're snapping at people you love for no real reason. Maybe your periods are all over the place, or you're gaining weight even though you're eating the same things you always did. And maybe, just maybe, you have Googled it. You've seen the word perimenopause, and then you thought, am I too young for that? Well, here's the truth. You're not alone and you're not going crazy. What's happening to your body has a name, it has a reason, and there's actually a lot you can do about it. Hi, I'm Dr. Bazgha Khalid, and I'm a board certified internal medicine and obesity medicine specialist. I see women just like you and me in my clinic every single week. And today I'm going to walk you through the 10 most common signs of perimenopause, what they really are, why they happen, and what you can realistically do about them. So grab your coffee, sit down, let's talk. And before we dive in, if any of this sounds familiar, drop a comment below. Tell me which one hits home. Okay, so first, what even is perimenopause? Think of it like this. Your body has been running on a hormone engine, mainly estrogen and progesterone, since you were a teenager. That engine is what drives your periods, your mood, your energy, and even your metabolism. Perimenopause is when that engine starts winding down. Not all at once, not overnight. It's a transition. And it can start as early as your late 30s, but most commonly, it kicks in your mid 40s. Now, here's what nobody tells you: it doesn't just last a few months, it can last 4 to 10 years. That's almost a decade of your body's shifting gears. And the tricky part, estrogen doesn't just smoothly drop down, it fluctuates wildly first. One day it's high, one week it crashes. It's like a roller coaster. And that's why the symptoms feel so unpredictable. But here's one thing: once you understand what's going on, once you can name it, you stop feeling like you're going crazy. And that's already a big deal. All right, let's get into the perimenopause symptoms. Symptom number one: irregular periods. This is usually the first most of us notice. Irregular periods. Now, if your periods have been like clockwork your whole life, every 28 days, predictable, consistent, and suddenly they are not, that's worth paying attention to. Maybe they are coming every 3 weeks now, or every 6 weeks. Maybe they are heavier than normal, flooding, clotting, all of that, or lighter, or shorter, or they're just arriving whenever they feel like. Why does this happen? Your ovaries are responsible for releasing eggs, and for most of your reproductive life, that process is pretty consistent. But in perimenopause, your ovaries start skipping ovulations. Some cycles you ovulate, some months you don't. When you don't ovulate, your progesterone, the hormone that thins the uterine lining, does not rise the way it should. And the result, your lining builds up. And then when it does shed, it can be a lot. That's why heavy periods are so common in early perimenopause. It's not a fluke, it's your hormones. Now, this is important. Irregular periods alone don't confirm perimenopause. Other things can cause irregular bleeding as well, like thyroid problems or fibroids or even stress. So please, if your periods are suddenly all over the place, get checked. Don't just assume. But if you're over 40 and your periods are unpredictable, perimenopause is absolutely on the list. Symptom number two is hot flashes and night sweats. Now, this is one that resonates with almost everyone. This is a classic: hot flashes and night sweats. If you've ever had a hot flash, you know exactly what I'm talking about. You're sitting there completely fine, and then out of nowhere, a wave of intense heat just rolls through your body. Your face goes red, you start sweating, your heart might race a little, and then a few minutes later, it's all gone. At night, this shows up at night sweats. You wake up drenched, sheets soaked. It's not pleasant. These are called vasomotor symptoms, and studies show that up to 85% of women experience them during the menopause transition. 85%. So if this is you, you are in a very, very good company. Here's why they happen. Your hypothalamus, that's the part of your brain that acts like your body's thermostat, is extremely sensitive to estrogen. When estrogen fluctuates, your thermostat goes haywire. It thinks your body is overheating when it is not. So it tries to cool you down fast. Blood rushes to the skin, you flush, you sweat. It's not dangerous, but it is disruptive, especially when it's waking you up at 2 or 3 or 4 in the morning. And here's something interesting. A 2024 research review found that regular exercise can actually reduce both the frequency and intensity of hot flashes. So, movement isn't just good for your body, it may actually calm that thermostat down. I'll talk more about what actually helps later, but for now, if you are waking up sweating like you have run a marathon, this is likely why. Symptom number 3 is sleep problems. This one really affects quality of life. And honestly, for a lot of my patients, this is the one that hits hardest. Sleep problems. I don't just mean trouble falling asleep. I mean waking up at 3 a.m. and lying there for 2 hours, brain going a million miles an hour, or falling asleep fine but waking up exhausted, like you never really got deep sleep at all. Around 40 to 50% of perimenopausal women report significant sleep disruption. That's nearly half. And this is where it gets complicated because it's not just one thing causing sleep problems, it's several things layered on top of each other. Number one, hot flashes and night sweats literally wake you up. It is hard to sleep through a heat wave in your own body. Number two, progesterone, which naturally drops in perimenopause, is actually a calming hormone. It has a mild sedation effect. When it drops, some women feel more wired at night, more anxious, and harder to settle down. Number three, your cortisol rhythm changes too. This also contributes to disrupted sleep. Now, here's a really important point I want you to hear. Poor sleep isn't just annoying. Poor sleep makes almost every other perimenopausal symptom worse. It raises your cortisol, it increases insulin resistance, it worsens mood. It makes weight gain harder to fight, so sleep is not optional. Sleep is medicine. And if you're struggling here, this is one of the first things to talk to your doctor about. Symptom number 4 is mood swings and anxiety. Many women feel shame about this one, and I want to spend a little extra time on this one because this is the symptom women are most likely to dismiss, minimize, or blame themselves for. Mood swings, anxiety, irritability, anger. You snap at your partner over nothing. You cry at a commercial. You feel anxious about things that never used to bother you. You feel like you're losing your mind, and then you feel guilty about it, which makes everything worse. Here's what I want you to know. This is not your fault or personal failure. This is chemistry. Estrogen has a direct effect on serotonin, which is your feel-good neurotransmitter. It also influences GABA, the calming chemical in your brain. When estrogen fluctuates wildly, which is exactly what happens in early perimenopause, these neurotransmitter systems get disrupted. Your brain literally doesn't have the hormonal support it used to. Studies estimate that somewhere between 10 to 20% of women experience clinically significant mood symptoms during perimenopause. And some research links estrogen changes directly to depression during this transition. Now, I want you to be careful. Not every case of anxiety or depression in a woman over 40 is perimenopause. Life is complicated, stress is real, midlife comes with its own challenges, kids, careers, aging parents, all of that matters too. But if your mood has shifted in a way that feels new, unusual, or out of character, and you are in your 40s, it's worth exploring the hormonal piece. Remember, you deserve support. You are not just being emotional. Symptom number 5 is brain fog. This one surprises a lot of women because they don't expect it to be hormonal. Brain fog, walking into a room and forgetting why you went there, losing words mid sentence, struggling to concentrate in meetings, feeling like your brain is running through a maze. I had a patient once, sharp, successful, ran her own business, and she came to me saying, I'm scared. I think I'm getting early dementia. She was 44. It wasn't dementia, it was perimenopause brain fog. Here's the science. Estrogen is neuroprotective. It helps with blood flow to the brain. It supports the memory centers, particularly the hippocampus. When estrogen starts to fluctuate, some women notice very real changes in cognition, memory, focus, and mental clarity. And here's the thing, this is not permanent. For most women, cognitive symptoms improve after the menopause transition is complete, once hormones settle down. But in that in between time, that can be many years, it can be genuinely frightening. Poor sleep makes brain fog dramatically worse, so does high cortisol, poor blood sugar control, and dehydration. If you're feeling less sharp than you used to, you're not imagining it. And you don't need to panic, but you do need to take care of your brain. Symptom number 6 is weight gain, especially belly fat. Now, this is the big one for most of my patients, and this is one of the main reasons why they come and see me. Weight gain, specifically belly fat. You're eating the same, you're moving the same, maybe you're even trying harder than you did before, and still the belly is growing. Clothes don't fit. The number on the scale keeps creeping up, and you feel like you're failing, like it's your fault. It's not your fault. Here's what's happening inside your body. Estrogen plays a major role in regulating where your body stores fat. When estrogen is high, like in our 20s and 30s, your body tends to store fat in your hips, thighs, and bum. That's your typical female distribution pattern. But when estrogen drops, your body switches its fat storage address and it moves it to abdominal area. That's the dangerous kind of fat, visceral fat, that sits deep around your organs. And yes, studies confirm that even just the drop in estrogen during perimenopause can trigger a 5 to 8% increase in visceral fat. And it gets more complex. As estrogen drops, insulin sensitivity also decreases. Your cells become less responsive to insulin. So the same food that never used to cause blood sugar spike, now they do. And high insulin drives fat storage, especially around the belly. Progesterone also drops first in perimenopause, and progesterone plays a role in metabolism and appetite regulation. Less progesterone can mean slower metabolism and more hunger. And then, on top of all of this, women lose muscle mass from their late 30s onward if they are not actively building it. Less muscle means a slow resting metabolism, which means fewer calories burned at rest. So the weight gain of perimenopause isn't just one thing. It's a perfect storm of hormones, metabolism, and muscle loss, all hitting at the same time. But here's the key message. This is biology, not willpower, not laziness, biology. And that means there are biological tools to address it, which I'll get into in a minute. Let me ask you something. Has anyone told you that your weight gain is just aging and there's nothing you can do about it? Let me know in the comments. Symptom number 7, fatigue. This is closely tied to almost everything we talked about so far. Fatigue, bone deep, cannot explain it, tiredness. Not tired because you ran a marathon, not tired because you had a long week at work, just tired. Waking up tired, tired by noon, needing a nap you never used to before. Now, fatigue is perimenopause is rarely one single cause. It's usually a combination. Poor sleep, obviously. You're not getting restorative deep sleep, so your body never fully recharges. But also, low estrogen affects mitochondrial function. Your mitochondria are the energy producing engines inside your cells. Estrogen supports them. When estrogen drops, those little engines don't fire as efficiently. And then there's thyroid health. This is something I always check in my perimenopausal patients. The thyroid, which controls your overall metabolic health, can become sluggish around this time. It's not caused by perimenopause directly, but thyroid issues and perimenopause often overlap in women in their 40s. And hypothyroidism or low thyroid causes extreme fatigue. If you are exhausted all the time, please get your thyroid checked. Ask your doctor, it's a simple blood test. Also, get your iron checked. Heavy perimenopausal periods can drain your iron stores. Iron deficiency is one of the most common and most missed causes of fatigue in women over 40. So do ask your doctor for iron check as well. Remember, tired is not your new normal. It's a sign. Listen to it. Symptom number 8 is low sex drive and vaginal dryness. I know this is the one people might feel awkward talking about, but we are not going to be awkward about it because this is medicine and this is real life. Low sex drive and vaginal dryness. Estrogen is responsible for maintaining the health of vaginal tissue, its thickness, its lubrication, its elasticity. When estrogen drops, that tissue thins and dries out. Sex can become uncomfortable or even painful, and that pain over time can naturally reduce desire. This is really, really common. More than 25% of postmenopausal women report pain during sex, and likely even more experience reduced desire, but don't bring it up with their doctor. Please bring it up with your doctor because this is treatable. Topical estrogen low dose applied locally is safe, effective, and can genuinely restore comfort. It's not scary, it's just medicine. Remember, you deserve a fulfilling, intimate life at every age. This does not have to just be something you accept and move on from. Symptom number 9 is joint pain. Many women don't know this is hormonal, and this one genuinely surprises people. Joint pain. Achy knees, stiff hips, sore shoulders, creaky in the morning, joints that didn't bother you before, now they do. And you probably thought that's just aging, that's just life. But actually, about 50% of perimenopausal women report joint pain. And there's a very specific reason. Estrogen is an anti-inflammatory hormone. It helps protect joint tissue. It supports collagen production, which is the structural protein that keeps your cartilage, tendons, and ligaments flexible and strong. When estrogen drops, inflammation in the joints can increase. Collagen production slows down, and the result is those aches and pains that seem to come from nowhere. This is also why some women notice skin changes around this time as well. Dryness, thinning, loss of that natural plumpness. It's the same mechanism. Lower estrogen, lower collagen. Strength training, protein intake, omega-3 fatty acids, and anti-inflammatory nutrition can all help here. And again, treating the underlying hormonal picture often helps too. Symptom number 10, heart palpitations. Now, this is one that scares people, and this is the one that sends women to the emergency room. Heart palpitations, a fluttering in your chest, a racing heartbeat, that feeling like your heart skipped a beat or did a little flip. And it comes out of nowhere, lasts a few seconds or a few minutes, and then it's gone. Terrifying, absolutely terrifying. I completely understand why women think something is seriously wrong with their heart. And yes, always get it checked, always. You want to rule out any true heart arrhythmia, especially if you're feeling dizzy, lightheaded, short of breath, or like you may pass out. Those are all red flags. Get to a doctor as soon as you can. But for most perimenopausal women, after a normal heart workup, palpitations are mostly hormonal. Estrogen receptors are actually present in the heart tissue. Estrogen influences the electrical activity of the heart. When it fluctuates, particularly in wild ups and downs of early perimenopause, some women feel that as heart palpitations or heart racing. Hot flashes and palpitations often go hand in hand. And when your nervous system overreacts to those estrogen swings, your heart rate can fluctuate along with it. Magnesium, by the way, plays a role in regulating heart rhythm, and estrogen actually helps your body utilize magnesium. So, when estrogen drops, magnesium deficiency can worsen heart palpitations or heart racing, something worth discussing with your doctor. Once you know what's causing these symptoms, they are still uncomfortable, but they're a lot less scary. Now you know the 10 common symptoms of perimenopause. And before we talk solutions, I want to address a few things that women are often told. That's just plain wrong. Misconception number one: you're too young for perimenopause. Wrong. Perimenopause can start in your late 30s. The average age is mid 40s. If you're 42 with irregular periods, hot flashes, and brain fog, this is absolutely in the conversation. Your symptoms are valid regardless of your age. Misconception number two: just eat less and exercise more. I hear this constantly and it frustrates me deeply because perimenopause weight gain is not a willpower problem. It's a metabolic hormonal shift. The rules change. The same strategies that worked in your 30s don't essentially work anymore. You need to adapt, not try harder at the same old thing that is not working anymore. Misconception number three: these symptoms will pass on their own, just push through it. Well, some will, but some won't. And suffering through years of poor sleep, anxiety, weight gain, and pain when there are safe, effective treatment options, that's not strength. That's an opportunity missed. Misconception number four: hormone therapy is dangerous. Now, this one deserves its own video, and I'll do that one day. But the quick version is this: the fear of hormone therapy comes largely from a study in early 2000s that has since been significantly reanalyzed. For most healthy women under 60 or within 10 years of menopause, the benefits of hormone therapy outweigh the risk. The conversation has shifted dramatically in the medical community. Please don't avoid learning about hormone replacement therapy because of 20 years old headlines. All right, so what can you actually do to help yourself during perimenopause? Let's get practical. Number one: strength training. Not optional anymore. I can't say this enough. Lifting weights or resistance training of any kind is one of the most powerful things a perimenopausal woman can do. It builds and preserves muscle, which protects your metabolism. It improves insulin sensitivity. It protects your bones, which estrogen was protecting before. 2 to 3 sessions a week. Start somewhere, start small, just start. Number two: protein. More than you think you need. Most women in my clinic are significantly under eating protein. Aim for at least 30 to 35 grams of protein per meal. Protein preserves muscle. It keeps you full. It stabilizes your blood sugar. Chicken, fish, eggs, Greek yogurt, legumes, build your meals around protein first. Number three: sleep hygiene is non negotiable. Consistent bedtime, cool dark room, no screens in the hour before bed. If hot flashes are waking you up, a cooling pad, lighter pajamas, and keeping a fan on can really make a real difference. And if sleep is still terrible despite all of that, please talk to your doctor. There are options. Number four: blood sugar management, because insulin resistance is often part of perimenopause. Your blood sugar matters more than ever. Reduce ultra processed foods, eat fiber with your carbohydrates, don't snack constantly, allow insulin to come down between meals. Walk after eating. Even a 10-minute walk after a meal meaningfully lowers your post meal blood sugar. And consider wearing a glucose monitor to see your blood sugar numbers. It can be a very helpful tool to see your sugar response to different foods, stress, sleep, and exercise. I use Stello. This is a non prescription monitor that I love. It is not an advertisement or sponsorship. I buy it, costs around $100 a month, and I use it myself, and I really like the real-time feedback. Number 5, talk to a doctor who actually knows about perimenopause. This is crucial. Not every doctor is up to date on this. Look for someone who is perimenopause informed. Ask specifically about hormone replacement therapy and see if this will be helpful for you. You deserve a doctor who takes this seriously. And number 6, stress management. Cortisol, your stress hormone, is a direct antagonist to estrogen and progesterone. Chronic stress worsens virtually every symptom we have talked about. Meditation, breath work, time in nature, therapy, these are not luxuries, these are medicine. Here's what I want you to take away from all of this. Perimenopause is not the end of anything. It's a transition, a real one, a challenging one for many women. But it's also an invitation to pay closer attention to your body, to advocate for yourself, to stop accepting this is just how it is, even when better options exist. The women I see in my clinic who do the best through this transition, they're not the ones who suffer in silence. They're the ones who show up, ask questions, make changes, and get support. You are doing that right now by watching this video, by learning about your own body. That already puts you ahead. Your 40s and your 50s can be some of the most powerful, energetic, clear-headed years of your life. With the right information, the right support, the right tools, the right strategy, that's not wishful thinking, that's medicine. Okay, this was 10 symptoms of perimenopause. I want to hear from you. Which symptom surprised you the most? Which one have you been dealing with that you didn't know was related to hormones? Let me know what other symptoms you have had that I didn't mention in the top 10 list. Drop it in the comments. Your comments might help another woman going through the same thing. If this video was helpful, please share it with a friend, with your sister, your mom, your coworker, because so many women are going through this and have no idea what's happening to them. You sharing this video might be the thing that finally gives them an answer. If you haven't already, hit subscribe and click that notification bell, because I post new videos every week on weight loss, metabolism, hormones, and everything in between. I'll see you in the next video. Take care of yourself. You're worth it. Bye for now.